When two sound waves occupy the same physical space, they are added together. If two sound waves are perfectly matched, meaning that they have the same frequency and their peaks in amplitude occur in the same moments, then the effect will be that their amplitudes increase as a sum of the amplitudes of the two waves. We'll perceive this as an increase in volume. If two sound waves are perfectly offset, meaning that they have identical frequencies and the peaks in amplitude in one sound wave occur at the same time as the troughs in amplitude of the other, then the sound waves will cancel each other out, as if we are adding a positive number to a negative one. We will perceive this as silence. The idea of noise-canceling headphones is that they monitor the sound in the world, invert it, and then play the inverted sound into your ear to offset the amplitudes of the sounds hitting your ear from the real world. When sound waves aren't perfectly matched, then a complex interaction occurs between them. If one sound wave is moving at 120 Hz and another sound wave is moving at 300 Hz, then there will be a constant fluctuation in states between the waves, as they'll sometimes be aligned as amplitudes increase toward a peak or a trough, which will have a summative effect that proportionally increases their combined amplitude. And sometimes be opposed so that one wave's move toward a peak is canceled by the other wave's move toward a trough, which will proportionally reduce their combined amplitude. The effect is to create a complex sound wave, which is the sum of each individual sound wave. In modal voicing, the vibrations of the vocal folds within the pulmonic airstream create a sound wave, which we know as fundamental frequency. As that sound wave travels outward in all directions from the glottis, parts of the sound wave strike the parts of our body that the sound wave is moving through. The amplitudes of these portions of the sound wave will be weakened a bit because some of the energy from them will be transferred into the structure that they've hit. The rest will be redirected in the form of a new sound wave moving at a different frequency from the original sound wave because of the collision. And this sound wave will then interact with the original sound wave to form a new complex wave. In effect, this second wave will be riding on top of the first wave. This is the fundamental acoustic fact of voiced speech. The vocal folds produce fundamental frequency, which we perceive as a speaker's pitch or tone of voice. And then the articulatory tract interacts with it to add additional frequencies on top of it. And we associate particular combinations of additional frequencies with particular phonetic segments, especially with vowel segments. We call these additional frequencies that ride on top of the fundamental frequency formants. This model of the acoustics of speech is often described as the source filter model. In source filter model, the vocal folds are a source of sound. That sound emanates from the source and is filtered by the articulatory tract. More specifically, the vocal tract within the model is conceptualized as a tube which is closed at one end, the glottis, and then open at the other, normally the lips, which are open to the world, where sound leaves the tube. The tube of the vocal tract is then further divided into two tubes by the tongue, so that the pharyngeal cavity is one tube which sits between the glottis and the tongue, and then the oral cavity is a second tube that sits between the tongue and the mouth's opening. Additionally, the nasal cavity is a tube that sits on top of the oral tube, and sound can be diverted into it, which will lay additional frequencies on top of the speech signal. Within this model, the tongue's role is to shape the size of these tubes and manipulate the formants that are being added to the fundamental frequency. In particular, the tongue will increase or decrease the size of the pharyngeal cavity and increase or decrease the size of the oral cavity. As the size of cavity decreases, the frequency of sound waves that are interacting with it will increase. And when those sound waves are in the frequency range that we can perceive, we'll perceive those sound waves as having a higher pitch. As the size of a cavity increases, the frequency of sounds interacting with it will decrease, and we'll perceive those sound waves as having a lower pitch. We always introduce vowel articulation by talking about the tongue's position, and we think of the tongue being low or high or back or front. And that is generally right, but it's also a bit inaccurate. First, the source filter model highlights that it's not really the tongue that's shaping the sound stream to make vowel sounds. Rather, the tongue is primarily responsible for shaping the sizes of the pharyngeal and oral cavities. And it's the sizes of the pharyngeal and oral cavities that provides the frequencies of sounds that we associate with vowel segments. Second, when we talk about the tongue, we usually think about the part that is in our mouth. And as a result, when we talk about height and backness, we tend to think about the part of the tongue that's up here. But the tongue extends down into the pharynx, and that part of the tongue down there is very much involved in the tongue's shaping of the pharyngeal cavity. You can feel this if you grip your throat just above the larynx and then switch between saying the vowels in fleece and trap. E, ah, e, ah, e, ah. When you do this, you'll feel the root of your tongue push forward on E and back on A. When you push your tongue forward down at the root, you expand your pharyngeal cavity and lower the frequencies associated with it. And when you push it back, you shrink your pharyngeal cavity and raise those frequencies associated with it. Actually, the formant you're creating to differentiate between these vowels is the one that on the IPA chart is associated with vowel height. So when we talk phonologically or acoustically about the tongue creating high vowels, articulatorily, the most relevant factor is the way the part of the tongue down in the pharynx is expanding or compressing the pharyngeal cavity rather than tongue height per se. We can describe most vowels, especially in English, on the basis of two formants, which we label F1 and F2. For most vowels, the size of the pharyngeal cavity is most closely associated with F1, and the size of the oral cavity is most closely associated with F2. Ladefoged and Dissner describe a way to isolate F1 and F2 so we can easily hear the changes in pitch associated with different vowels. F2 is fairly easy. You whisper and then work your way through a scale of the front vowels on the IPA chart. As you progress from E to A, you'll perceive a steady decrease in pitch. E, This corresponds articulatorily to an increase in the size of the oral cavity between the tongue and the opening of the mouth. F1 is more difficult. However, if you force yourself to go into creaky voice and then work through the same scale, you'll hear pitch steadily rise from E to A. This corresponds to the pharyngeal cavity being shrunk. We can plot these frequencies on a two-dimensional plane. We plot F1 on the y-axis and reverse the direction of the scale so that low F1 appears at the top of the chart and high F1 appears at the bottom. This places vowels that we traditionally categorize as high or close at the top of the chart and low or open vowels at the bottom. We plot F2 on the x-axis. Again, we reverse the normal direction of the scale, which plots high F2 to the left and low F2 to the right. This places front vowels on the left of the plot and back vowels on the right. The result is that the frequencies plotted for F1 and F2 recreate the traditional IPA chart. Indeed, Ladefoged and Dissner suggest that the phoneticians who developed the first versions of the IPA chart, while they thought they were creating a chart on the basis of articulatory features and tongue position in particular, were actually charting perceptual qualities of formant frequencies. Of course, this actually makes sense because the formant frequencies were what they were perceiving as they worked.